A dozen registered nurses working at UIC Hospital in Chicago have now tested positive for COVID-19.
The Illinois Nurses Association tells me that some registered nurses here at UIC have had to work on the COVID care unit without personal protective equipment.
We had been demanding surgical masking for everyone. We knew, nurses knew, that walking around and only having an N95, that wasn't enough.
Loved ones lamenting the loss of 63-year-old Maria E. Lopez, who was due to retire from being an operating room nurse when the COVID-19 crisis brought her back to the front lines.
You know, we're nurses, and our attitude is to help. And Maria was exemplified that.
Joyce Pacubas LeBlanc was a nurse for more than 30 years in Chicago, working in the intensive care unit at University of Illinois Hospital. She was nurturing to whoever needed it.
I absolutely blame UIC for not protecting their staff more, and I absolutely blame them for the death of my friend Joyce. Ty would say, we didn't kill these people, COVID did. They had a part.
I'm immunocompromised. I have multiple sclerosis, so I take medications so my immune system isn't so overactive, because with MS, that's what causes exacerbations. That leaves me more susceptible to coronavirus, being around patients that are positive and other employees that are positive.
I love being a nurse. I love taking care of my patients. I love taking care of my families. It will always be there. But I wish the hospital had our back. I wish we were safe.
I absolutely believe that we have been martyred against our will, that the position we were put in to take care of these patients without proper protection for ourselves and for them has been unfair and ultimately is a failure on part of our upper leadership.
We were under fire this whole pandemic, and we were telling you what we needed. We were voicing what was happening, and you were in your offices or wherever you were remotely while we were fighting and while we were dying and while we were getting sick. We haven't seen her since the beginning of the pandemic, so that says enough for me.
995 versus 12. I told my husband that and he laughed. He thought I was like wrong with the numbers. I'm like, no. He said it said 995, you know? The other 12 probably were just so scared or probably over it. You know what I mean? Probably just tired of asking for basic, necessities or worth. But I expect to see change on that picket line. We're showing them we're not taking it. I'm not a mediocre nurse. None of the people that I work with are mediocre, so that's what I want to say. Treat us like we are, like we're gold.
Every nurse that works at our hospital is committed to finalize our contract and really push for the safe patient limits they deserve and our patients deserve.
Actually, in my Buddhist tradition, we speak of many in body, one in mind. I believe that together we can get what we want and what we deserve. If we come all together, we just speak the truth, and everything else will fall into place.